You are listening to the Age Like a Boss podcast, episode 8. In today's episode, I'm going to continue my series about my 2024 Menopausal Metabolic Makeover. Now, these are all of the steps that I have taken so far this year, maybe not all, and certainly not the only steps I'll take in the future, that really revamped my metabolic health this year and helped me correct my hemoglobin A1C and my LDL cholesterol. Stick around. Hey everyone, welcome to the Age Like a Boss podcast. I'm your host, Jennifer Singh. Now, so far in part 1 and part 2 of this series, I have been covering the exact steps that I took starting at the very beginning, which was really a change in my mindset and how I was thinking about my health journey. You can go back and listen to part 1 and part 2 to hear more about that. Hey there, if this is your first time here, I'm Jennifer. Welcome. If you are a woman over 40 who is dealing with changes in your body, your metabolism, your weight, your health, and your mind after age 40, you're in the right place. We're going to talk about all of the lifestyle things to reach our peak physical and mental health and generally age like a boss. Now, in this series, we're on part 3 today. I've been covering all of the things that I did during 2024 to upgrade my metabolic health. Now, you can go back to part 1 if you want to hear the origin story, but I'll give you the short version. I got my lab work done at the beginning of this year, and I was pretty underwhelmed. I wanted it to be not just normal, I wanted it to be perfect, to be exemplary, and it was kind of high normal. My glucose handling, which was measured by my hemoglobin A1C, was not as low as I would have liked. And my LDL cholesterol was not as low as I would have liked. So I really embarked on a deep dive this whole year to see how many changes I could make and really reevaluate what my goals were for my own longevity and my own health. So this is part 3 of that series. In part 2, I covered some basic sort of classroom explanation for insulin resistance, insulin sensitivity, which I jokingly call perky insulin receptors, and the origin of diabetes, and how just eating a low carbohydrate diet doesn't always fix the underlying problem, which is that insulin resistance. Now, one more thing I want to add is that no one needs to consider this their personal to-do list. I'm just sharing with you how it took 1 year for me to continue to tweak, continue to gently change habits, upgrade habits, move more, continue to improve my nutrition. And it didn't happen overnight. This is something I've been working on for a whole year. So I do find that people have really unrealistic expectations of themselves. So please don't listen to any single part of the series or the whole thing and think, oh, okay, well, I have 1 month to implement all of these changes. No, you don't. You have as long as you want it to take. I just want to encourage you to keep being curious and keep thinking about how can I do a little bit better if I still don't have the health outcomes that I want. So today, let's continue on the steps that I took to complete this makeover. Okay, so the next step I want to share with you is, drumroll, dramatically increasing my movement during the day. Now, look, I jokingly tell people this all the time. You don't need me to tell you to eat more vegetables and take a walk. I mean, duh, we all know that, right? That's not actually the question. Will eating vegetables and walking more help me? Universally, most people would answer yes. Here's the real question and what we need guidance and community on. How do I get myself to do it, right? So I had lab work that I wasn't completely pleased with. And I did know, of course, the cardiovascular benefits of exercise. But back in part 2 of this series, I mentioned that I had experimented with wearing a continuous glucose monitor, even though I am not diabetic. Disclaimer, I also said that I don't necessarily recommend that everyone run out and do that. I will do a future series on CGM soon. However, here is one fascinating thing that it taught me. That walking or movement immediately after a meal or a snack has a dramatic and immediate effect on blood glucose. Now, I know, I'm a doctor. I've taken care of people with diabetes. I have always known the power of movement on glucose handling and insulin sensitivity. But truthfully, I didn't realize it worked that well. It was only while wearing the CGM that I was able to gamify, like make a game out of eating something, seeing a normal, healthy rise in my glucose level, and then watching the incredible effect that movement or a walk had on that glucose level. So while glucose elevations are normal and natural and part of biology, it also is a great habit to just get into the regular lifetime habit of learning to take a walk after you eat. This is one thing that I incorporated really vigorously into my day. I began to eat, walk, sit, which was a completely different pattern than what I had been doing. You see, I had been actually following the current guidelines for exercise, accomplishing anywhere from 30 to 60 minutes of movement every morning before I started work. Then, however, I would sit at my desk and sit and sit and sit some more and sit sometimes for 8 or 9 hours as I got deeply into my work and thinking to myself, well, I've already exercised today. And I sort of had to have an intervention with myself and say, sis, you're sedentary. Like, I know you're moving, but the fact is that your cumulative sitting hours is dreadful. You've got to get up. You've got to move more. Wearing the CGM showed me that intermittent movement, which I have read other authors call those movement snacks or exercise snacks, and I love the idea of that, not only is a powerful regulator of our blood glucose, causing an immediate lowering and use of that glucose by our muscles, but also there is great evidence that exercise snacks, even after a whole 30 to 60 minutes of movement first thing in the morning, continues to have a more powerful regulation effect on blood pressure also. This is a win-win. If you can incorporate a habit like this into your life, you will see better glucose management and probably better blood pressure control also. So the old habit was exercise for an hour in the morning and then sit all day long. The new habit is exercise in the morning, eat some breakfast if you're going to have it, move for at least 5 to 15 minutes, and if you can't get out to take a walk, even piddling around the house, reboot the laundry, sweep the floor, vacuum something. Just don't sit yet, then sit. And that can be a new pattern. Eat, walk, then sit. This is especially powerful in the evening because here in the US, we tend to eat the bulk of our calories in the evening when we come home, right? During the day, we're working outside the home sometimes or working in the home. We don't have to deal with our families. It's in the evening when most of us feel like we are drawn to or tend to consume most of our calories. Without walking or moving before retiring for the night, especially if you know that you have insulin resistance in the form of prediabetes or diabetes, is just inviting your body to go to bed with an elevated glucose and have to continue to deal with it all night long by pumping out insulin. Again, elevations in glucose are normal. However, simply the habit of getting into a routine of eating and then movement before you sit and rest or go to bed for the night is fantastic, even for people who don't have insulin resistance or glucose elevation problems. It's just a great habit. If you do have those problems, what you will allow your body to do is utilize or sort of suck up some of that glucose and go to bed with a more normalized level. Now, after you sit down or lay down, your glucose frequently will bounce back up. That's fine. That's normal. Your body is still sucking up and using the food that you ate, but you have given your metabolic system a real help by getting that glucose down before you go to bed. Now, one word of warning, if you are a type 1 diabetic on insulin or a type 2 diabetic who is also on insulin or another glucose-lowering medication, hopefully you already know to be very careful with your exercise and planning for it with your glucose monitoring and your insulin monitoring. This method is so effective that it's actually possible for you to become hypoglycemic if you are insulin dependent or on another sulfonylurea or another medication that lowers blood glucose effectively. So again, me telling you that we need to walk more is not a big shocker. The big question is, yes, but how do I get myself to do it? So here's what I did. I knew that I had to change my environment to make it sort of easier and maybe even stupid easy to get more movement in during the day. So I got onto the trend and bought a walking pad. I can tell you with hand over heart, I think probably it was the most powerful $110, $20 investment that I've made in my health in a very long time. Here's an economical tip. Ask your neighbors. There are people all around you who have graveyards of fitness equipment, right? So if you're wanting to be economical, maybe post on your local buy-sell group and ask, anybody want to get rid of a treadmill or a walking pad? That's how I got mine. I got a very good piece of equipment for a ridiculously low price. Okay, moving on. So the next thing I did was buy a weighted vest. Now, all of the disclaimers and caveats, please. If you have neck issues, back issues, lower back issues, hip issues, if you are under the care of a physical therapist, a rehabilitation doctor, or any movement specialist, please use your brain. Get this cleared before you go and start wearing extra weight on your upper torso. It is not appropriate for everyone. Please make sure it's appropriate for you. But I saw people online wearing these things and I was like, that looks like fun. What's up with that? So the evidence for wearing a weighted vest mainly has to do with two different aspects of health. One is that it simply increases the intensity of your exercise. It's just harder, right? And I found that when I was walking my little dog around, who is not a very athletic dog, that it took me forever to get around the block and that there was a lot of stopping and starting. And I really wanted to kind of increase the intensity of my walks. Wearing a weighted vest really helped with that. If you further gamify your walks by watching your heart rate, I was able to see that my heart rate actually got up a little higher when I was wearing my weighted vest, which you would assume that it would. Second, weighted vests have been shown to have a positive effect on bone mass maintenance in perimenopausal and postmenopausal women. So some studies have shown that wearing a weighted vest during walking can help women maintain bone during a time of life when they usually are losing bone. So while I didn't find robust evidence that wearing a vest actually grows a lot of bone back, that doesn't mean that evidence doesn't exist. It just means that I haven't read it so far. And if you have, please share it with me. What I did find was that wearing a weighted vest helps a woman keep her bone that normally she would be losing if she were in menopause and losing bone mass due to estrogen deficiency. So, third, it's just fun. I like wearing it. It feels fun. It feels almost like you're backpacking or rucking, which is another thing I've got to try coming up soon. And it just added a new shiny thing to my routine. Let me say something real quick about new and shiny things. So if you are someone who feels like you get bored very easily, you have found your person. I get so bored so easily, and I frequently love to swap up my routine or add something new, whether it's a new pair of socks or a new pair of yoga gloves or a weighted vest. And it is okay for you to keep gamifying or changing things up to keep your brain interested. That's fine. Nothing has gone wrong here. Okay, moving on. Last step I'll cover today, and this is a big one, is sleep. Listen, if you don't know for sure that you are getting a minimum of, I would say bare minimum of 6, most of us need 7 to 8. I actually am still struggling to get over 7, but at 7, I feel really, really good. It is time to get serious about your sleep. In midlife, we need sleep more than ever. Sleep quality begins to decline in midlife, and it is well documented that we are more easily awakened in midlife. So if you feel like I'm waking up all the time in the middle of the night, it could be that things that you previously slept through, now they're waking you up, and then you can't go back to sleep. Maybe you struggle with going to sleep at night, which is called sleep initiation, right? And that frequently has to do with caffeine, alcohol, medications, or what we in medicine call sleep hygiene. It just means that you're not doing the things prior to going to bed that help your body wind down, prepare for sleep, and release your natural melatonin. Now, entire books have been written about this topic, and I encourage you to read or listen to one if you would like. Today, I want to stress to you that if you have insulin resistance, prediabetes, diabetes, high blood pressure, any cardiovascular trouble at all, or are struggling with your weight, possibly the first and most important thing you might need to work on is your sleep. Now, as I mentioned in midlife, we go through normal sleep changes as we age, but definitely the loss of hormones that accompanies menopause can have a profound effect on sleep. Progesterone specifically appears to affect our sleep cycles, and adding progesterone has been shown to help women sleep better during midlife. Now, of course, whether or not that's appropriate for you is completely between you and your doctor. I was definitely able to see during the times that I was wearing a continuous glucose monitor for experimentation that on the nights where I woke up in the night and couldn't go back to sleep or felt like I hadn't slept well, the next day that I didn't seem to have as sensitive an insulin response, meaning that my average glucose the next day was frequently higher. Now, this could also be that on the days when I hadn't slept well, I almost always eat more. Have you ever noticed that? I will do some entire episodes in the future just on sleep, but suffice it to say that it's critical to your overall health, your metabolic health, and definitely your mental health. So I got a little crazy and serious about my sleep. And when I get ready to fix something, I throw everything at it. So it's impossible to say exactly which was the thing that helped my sleep. Some of the things that I did included having a discussion and getting on hormone replacement therapy for menopause. Then I got serious about my bedroom environment. I bought some new sheets. I got a new mattress topper that I thought would be more comfortable, and it was. I moved the air purifier fan thing that I have in my room around on my side of the bed so that I could sleep cooler in the night. I had gotten very lax about having the dog in the bed all the time, and it's just not good. The dog had to go back to his sleeping spot, and we've all been much happier, even I think the dog, since he's gone back to his sleeping place. But probably the thing that was the most difficult for me and likely had the most effect on my sleep was dramatically reducing my caffeine. My caffeine had gotten out of control. I think it started when I was a resident, and the nighttime, the stress, the whole ER culture of drinking coffee all hours of the night and day. I really spent the last 30 years drinking too much coffee, way too much coffee. And since transitioning away from clinic and working at home, when I thought it couldn't get any worse, it actually did get worse. So I was really functioning under my previous belief, which was that if I was falling asleep okay, then probably I was tolerating my current caffeine intake okay. But more research has really shown that caffeine has the ability to disrupt our sleep all night, including sleep maintenance. What that meant was just because I was falling asleep okay didn't mean that the caffeine wasn't still having a negative effect on my overall sleep all night long. So it was time. I realized that I really had to have another intervention and say, woman, you've got to cut back, way back. So I cut my caffeine down to probably 25% of what I was drinking in the past. And through all of these interventions, I am definitely sleeping better. I still do have some wake ups in the night, but I am able to go back to sleep and overall feeling great. That's all the steps we'll cover today. Don't forget to catch part 4 of this series and go back and catch the first 2 parts if you haven't. See you soon.